So good morning, sir. Our topic for PBL is needle breakage. So our case is patient experiences pain while injecting LA, due to which he becomes anxious and suddenly moves his head to the other side of operator. So this may lead to which complication? So the most appropriate complication with our case is needle breakage. Introduction. A number of potential complications are associated with administration of LA, like paresthesia, facial nerve paralysis, needle breakage, hematoma, edema, infection. Most appropriate with the case is needle breakage. So, breakage and retention of needles within tissues is nowadays rare due to introduction of disposable syringes. Causes of needle breakage: bending of needle before insertion, sudden unexpected movement by patient, forceful contact with bone, use of small needles when entire length needle is inserted into soft tissue, use of old dull needles, excessive lateral force by the operator, and defective manufacturing of needle.
Care and handling of needles. Needles must never be used on more than one patient. Needles should be changed after several tissue penetrations in the same patient. Needles should be covered with a protective sheath when not being used. No attempt should be made to change the direction of the needle while embedded in tissue. Needles should not be forced against resistance as they are designed to penetrate the bone. Smaller 30 and 27 gauge needles are more likely to break than larger 25 gauge needles. Needles recommended for specific injection techniques are presented in the section recommendations. Bending weakens needles, making them more likely to break on subsequent contact with hard tissues such as bone. Needles should not be bent if they are to be injected in soft tissues to a depth greater than 5 mm.
Prevention. Use large gauze needle and avoid use of old and dull needles of fine gauze. Use large needles for deep penetration, 38 mm. Do not insert a needle into tissue to its hub. Do not redirect the needle once it is inserted into the tissue. Excessive lateral force on the needle is a factor in breakage. Withdraw the needle almost completely before redirecting it. Do not bend the needle when inserting them into soft tissue. Do not use short needle for inferior alveolar nerve block in adults or larger children. Do not use 30 gauge needle for inferior alveolar nerve block in adults or children. Observe extra cautious when inserting needle in younger children and in extremely phobic adult or child patient.
If we look to the management of needle breakage, so when a needle breaks and it is visible, so you should stay calm. You should instruct the patient not to move. Do not remove your hand from patient's mouth. And if the fragment is visible, remove it with a hemostat or a Magil intubation forceps. And the secondly, when a needle breaks and it is not visible, so you should not be incising or probing. You should calmly inform the patient by taking the radiograph, determine if it is superficial. Then computed tomography scan and OPGs is used to find the retained needle, and the retained needle is removed in operating theater with the patient under general anesthesia. Thank you.